I would like to first address the one on Thailand from Vietnam and how we are different from other neighboring countries. And I think this is it's an opportunity for share and learn. It's not to say that Thailand has done it all right. And as a matter of fact, I was sitting on one of the ASEAN Food Standards Committee that talk about upper limits of nutrients. And we have to, I think all 10 countries have to come together and take a look at how we can agree. I find that we have a lot to share and learn about all this and appreciate it. I really felt that you take a look at EU, European Union, when they start off and they have all kinds of also different stages of countries that join. Not all of them are the same level. They learn from each other and bring that up. And I'm sorry to target this, but East Berlin, when Berlin became one, you can see the differences. And that is because people started to do that. It's the same way as food issue and any other issue on ASEAN. I want to touch on the local food. Thailand has one tambon, one product, which means one district, one product that are premium grade. Several of them are food. They have, these more likely the community are so proud of it, and they have to go through a lot of food safety procedure that the FDA and others come in, and because they are a model for others to learn from. So what do? We do community to community knowledge transfer. You do not teach farmer by having them go to school, but you teach them through their peer. And this is one of the things that I think we will be doing. Commercial foods under regulation are still a lot of gaps there, but regulations and rules, primarily they are upkeep, and that's enforcing if the law and other authorities are in place. The GM foods, I think this is beyond one country alone. We can't just say by country and country, how do you deal with political and media bias? I think that this has to be done by a central or international body that deals with this kind of, what are the evidence and what are that to be issued. Would FAO or combined with WHO joint committee would do that kind of a issue out the guideline would be best. You need to have that coming from an external body. Don't let the inside driven, because they're all very prejudiced and pull all over. So it's the blind leading the blind. We don't know what's happening. So this is what my response would be. Thank you.
Thank you very much. We have comments on the top. So
I just comment to our friend from Vietnam. He talked about that the farmer in Vietnam is aware about the contamination and about the diseases. But I think that we don't underestimate or overestimate this data, because what we are talking about magnitude. So when the research said that the reason why food-borne diseases happen because of the awareness of the farmers is very low, it means they're talking about the magnitude. So they are not talking about individual farmers, that there are maybe 2 or 3 individual farmers understand about the contamination, infection, and so on. But when research said that this is the result, the production process, handling process is the reason why the foodborne disease is coming from, then I think what they are talking is.
Thank you very much. Mindful, we have 4 minutes left if John's watch is correct. So we have room for a couple of more short interventions. Yes.
Yeah. After listening to you answer this question, shouldn't we spend for every dollar or for every second or third dollar on research and regulation, $1 on communication, and build it in the system in order to be more effective?
John has an answer to that.
Yeah.
No, I just want to support that because
Yeah,
I think
it's a good-
it's the knowledge, the communication, the understanding, incentivizing so people can participate that's really important. And
Yeah.
so I support that. Great.
Yeah. Okay.
Thank you for your wonderful presentation. I have a small question for Dr. Fang. In your presentation, you mentioned 3 kind of evidence. So in your opinion, which evidence is most important? Thank you.
I think as a researcher, for sure, research evidence is the most important. But when you come to the practice, especially for the policy making, it really varies, I think. Depends on the culture of the country or maybe it's hard to say, but to me, just myself, I think the decision should be based on research evidence, as I just mentioned before, informed by the other 2 types of evidence, but should be based on research evidence. That's just my kind of thinking.
Can I?
Sure, please.
Yes, I'd like to address the issue of NCD, particularly from the imported foods. And there has been a talk from the WHO. I was working with a group that work on diet, health, and trade. And it is really important to take a look at where trade makes a difference and how the non-tariff barriers, particularly if you have a problem of NCD, you have the right, based on the WTO, the country has the right to say, we need to bring up a nutrition regulation that will only, more likely take a look at what tariff for the healthy foods versus non-healthy should be different. I mean, there has to be, in a way, that was talked about. It has not yet been done, but I think it's time. If we talk of food-borne disease, that people, if you remember mad cow disease, if you remember Nipah virus, avian flu, all those control, maybe not to that extent of severity of scale, but still to apply. Country has the right. I really feel that we ought to use this momentum to say there's a right to protect our country people from having to eat poor quality diet.
Can I say something?
Chair,
Sure, we have 1 minute.
just
Yes.
to
2? Make up 2 minutes, okay. Okay.
Okay, yes, I just want to come back to the point of the law and regulation in Vietnam, just to make it clear that, because of course, East and West Berlin, etc. You see, I said that and we have law, and we see that it's not working at the moment. I just want to confirm that from long-term point of view, regulation wouldn't be really the basis of control and, really having the good food safety system. But by there, from the equity point of view, in Vietnam, let's take Vietnam for example, the small pig holders, small livestock raising pig, it represents 90% the pork consumed in Vietnam. CP was there. CP and some big company was there and represent about 10%. Yeah, and I think that this kind of thing, our research from INRI and other institutes show that it should last for at least 15 or 20 years. So for 15 and 20 years period, you have to do something for this informal market. So my point is, in fact, regulation is very important, and I agree with you that China and Vietnam, we share a lot of things, and when the party wants, everybody have to do. So that is no doubt for that. But by that, I think that we need to be flexible enough and really think to the poor, and think this guy is very flexible and adapt to the context.
Can I just quickly
Okay.
add to that?
30 seconds, okay?
Actually, I think I need to kind of clarify it. So it's not, say, the 3 evidences, they are contradictory to each other. They can be supplemental to each other. So the contextual evidence and the experiential evidence can help you to fit your research evidence to more suitable to the location or the population,
I'm sorry.
and also help you to sell your idea.
I'm sorry, I know people want to speak, but we have to stop here. let's all thank the panelists and thank you all for